There are other deformities that can occur in the forefoot besides bunions. One of the more common deformities that we see and we correct on a regular basis is called a hammer toe. A hammer toe, you may or may not know what that is, but it is a contracture of the joint, the first joint in the toe, and the toe ends up buckled and in many cases becomes arthritic and stiff in that crooked position. There are different varieties of hammer toes. There are flexible hammer toes, there are rigid hammer toes. There are toes that contract at both joints, not just the first. A severe hammer toe that actually contracts at both joints is called a claw toe, and that's a double contracted deformity. That's the worst type of hammer toe that you could have. Hammer toes tend to occur in both men and women, and they are usually a result of a muscle imbalance where the extensor tendon pulling the toe up and the flexor pulling it down is basically out of balance, and over time the instability of the toe results in a fixed contracted position of the toe. The problem with that is it doesn't fit in a shoe very well, and it tends to form a corn on the top of the bone that's protruding up. Now, hammer toes are probably the most common on the little toe, and that takes the brunt of the shoe pressure, and very often you'll have a bony prominence on more than one bone on the little toe, and women have problems with this, particularly in dress shoes that are pointed and tight. There's really nothing worse than a hammer toe that's inflamed and painful. It's very difficult to wear any shoe comfortably. So hammer toes can be fixed. It's a procedure that in some cases can be done in the office, and in others can be done at a surgery center depending on the severity of the deformity and other coexisting conditions such as bunions. Very often we'll fix a bunion and hammer toe deformity at the same time. When we fix a hammer toe, our goal is to get that toe as straight as possible and get it so that it is not being irritated in the shoe. Again, that's an outpatient procedure. It does involve some bone work. Sometimes we'll use an external pin or an internal pin to hold the bone in the right position. And sometimes we don't need to use a pin at all. But in any case, it is something that is correctable and does produce a lot of relief.